Hey guys, welcome back to 5nothing100nothing.com. I am Fugget, and that stands for the fittest underdog guru using intelligent tactics. Today guys, I want to talk to you about a client I had this morning, and she had some issues with a lower leg, specifically a plantar fasciitis issue, an issue with the bottom of her feet, and pain that was then kind of resonating up into like the calf area, right? Just below the knee. And she had finished several months actually of physical therapy. And so she kind of got her walking papers where it's like, okay, well now, do these things to keep it healthy. And so we were kind of going over that because she's trying to lose weight to get ready for her daughter's wedding in approximately 7 months, right? Now she doesn't have a lot to lose, but she wants to look her best. She wants to fit into her dress as the mother of the bride, and look her best. Like we all do, right? Well, we don't all want to fit in a dress, but you know what I mean. So anyways, she was going over the routine that she was giving by this therapist, and it always surprises me. I have a board-certified physical therapist who gives not well-rounded, complete advice, to their patients. So, there was nothing about soft tissue management, stretching. It was mostly exercises on machines. And so I kind of gave her some ideas, some exercises, some soft tissue things like using a foam roller for that soft tissue, that fascia that's over the muscle. Also some stretches, as well as some different calf exercises that are going to hit both the gastrocnemius, the bigger part of your calf, and then underneath that, you have a smaller, more medial muscle called the soleus. So we did those things, and all of a sudden, she's feeling, really good. So, the proof's in the pudding, the next day, like tomorrow, she'll have a better idea of how she felt. Like she might be a little bit sore from it. But the interesting thing to me was that the immediate pain relief that she felt just by doing some of these techniques. And I wonder if it would have taken or should have taken several months to get a little bit of results, and show a little bit of progress as far as the healing process. But it was interesting to me because I just think that sometimes you don't know what you don't know, and she's trusting the professional and following protocol, this and that. And I really couldn't see any reason why, these therapists or this team wouldn't have given her some of this advice. So, at the end of the day, you guys, I think, you trust the professional, but also don't be afraid to be self-informed, and do your homework. And I was really glad that I asked her a few questions to see what she was doing, because she really didn't talk about what the exit strategy was. She was just like, oh yeah, they said I'm done. I said, well, where's your pain? She's like, I don't know, 3 or 4 out of 10. So I'll just find a way to manage it. And I'm thinking, you don't have to, you don't have to live with that. There's, especially knowing what, she had done, what they were recommending. And I was like, well, there's a few things we can do here that are going to help you to feel a little bit better. So let's, implement these strategies and see what happens. So I was glad we had the talk, and that I may have helped her on her road to recovery, maybe expedite the process so that we can get to more aggressive exercise, and it'll keep her motivated because she's in less pain when she's on her diet and doing the things she's got to do to look her best. So just I give you that tip. I know it's not necessarily content that's specific for all of you, But for those of you that are dealing with any issues like that, or those that are trainers, perhaps that will help you out a little bit. So guys, like, share, subscribe. Let me know your thoughts on that. And I will talk to you all again soon. Take care.